You know, watching your aging parent suddenly seem confused can be one of the scariest moments in your whole caregiving journey. You love your parent. You treasure the conversations you've shared for years. So when you walk in and you find them slurring their words or struggling to follow a simple sentence, it hits you hard. And it can feel like grief showing up out of nowhere. I get that. You sit in your car maybe afterwards trying to catch your breath, wondering if this is it, wondering if they've had a stroke, wondering if your parent has crossed some invisible line into permanent decline. Hi, I'm Suzanne Fasella. I'm a retired physician assistant and senior care strategist. I have 20 years of experience helping and guiding adult children on how to care for their aging parents. So here's the good news. It might not be that at all. A lot of families assume sudden confusion, extra sleepiness, or a sharp personality change means the brain is failing for good. But often the real story is something much more fixable. Having worked the emergency room, I've seen this. So before you accept the hardest explanation, take a look at the medicine cabinet first. Take a look at those pills. Common prescriptions, even ones that seem harmless, can create a kind of chemical fog. That fog can look exactly like memory loss. And you may think they've been on this for years and they shouldn't happen. It does. Why pills kick in later and the side effects show up is because your aging parent is aging. Our organs slow down over time. The liver and the kidneys don't filter medication out of the body the way they used to. So a pill that worked fine for years can suddenly build up, stay active longer, and hit much harder than before. When was the last time your parents' pills were adjusted in dose? This gets even trickier when your parents are on 5 or more medications. And sometimes doctors call this polypharmacy. And every time a new specialist adds one more pill without checking the full list, the risk of a bad interaction goes up. And certain everyday medications are common culprits. Muscle relaxants, right? Anti-anxiety pills, bladder control medication, even over-the-counter sleep aids. Combined, they can sedate an older body more than anyone intended. And they can trigger confusion, blurred vision, or wobbly balance. The very things families mistake for dementia. And here's the part that makes this so hard to catch. Your parent doesn't want to lose their independence. We know that. So if the pill makes them dizzy or foggy, they may hide it. We know that. We'll find it everywhere, but in their mouth. And they will stay looking active and great until you leave. Or they'll blame it on a bad night of sleep. They're not trying to deceive you. They're scared that if they tell you anything, you're going to worry about it, and then you're going to want to control them, and then you want to take their independence. So it never works. You can't talk a foggy brain back into clarity. And you can't watch them every hour of every day without wearing yourself down. The better move isn't confrontation. It's building quiet systems behind the scenes that protect them automatically. We do this all the time. And here are 3 ways to do just this. First of all, start with a simple medicine cabinet check. Skip the questions and the interrogation. Don't ask them. Just on your next visit, quietly go through every bottle, every supplement, every over-the-counter pill in the house, and creams and eye drops too. Look for duplicates. Look for when they're supposed to be refilled, and take this list, write it down, and take this list over to the pharmacy. And ask them to compare it to something called the Beers, B-E-E-R-S, that's the doctor's name, criteria, because it's a list of high-risk medications for older adults. So you don't have to be the one that says this medication seems wrong. Let the pharmacist say it instead. Let the pharmacist tell you, and then you can ship it over to the doctor, and then the doctor can tell them later. So you didn't have to confront them at all. And finally, switch to that automated pill dispenser and the alarm that goes with it. The alarm will help them remember to take their pills and take the guesswork out of it. So they won't end up doubling up. I've had patients double up. It's amazing how many pills they take. They don't read the labels, and especially some of these steroid packs, they take all the pills at the same time. It's terrible. So caring for an aging parent through a moment like this is going to be emotional. But it's never meant to be a 24-hour watch. That's not who you are. That's not what you want. You're going to end up being powered by worry and adrenaline, and you just can't go there. You'll gain weight. The cortisol levels will be sky high. Don't do it. You're not the medication supervisor. You're meant to be their child. And a steady senior care plan means building small, quiet safeguards so you stop worrying about them. It protects their body, it clears the fog, and it lets you keep your dignity. I've seen patients rebound. I've seen patients that were on death's door. I've seen them thinking that they're going to die. And I've been able to get them up and running again so that they could go on vacations, they could travel, they can do all sorts of things. Yes, I thought they had dementia. Yes, I thought they had a stroke. They didn't. It was the medications. So look at this 25-point daily systems audit. Start there. It's the clinical tool I use on all my clients. And then I go from there as to what they need next. But I want to say something. Thank you for being here and for showing up for your parent the way you do. I appreciate it, and I know they do too. So thanks, and I'll see you soon. Take care.